Well, the Virginia Department of Health tracks COVID cases in a variety of ways by age, race, and more. It helps them look for trends in cases or how to target mitigation efforts.
They're also tracking whether it is a breakthrough case. That's someone who tested positive after getting vaccinated. New tonight, 10 of your sides, Marielena and Balouris explains why and how they do it.
If you've ever tested positive for COVID-19, you've likely received a call from the Virginia Department of Health. A case investigator will ask you a series of questions, including whether or not you're vaccinated, and that is something they'll verify. A positive COVID-19 test can be concerning. To help, case investigators with the Virginia Department of Health will call.
So they're going to be that first call to people who are sick with COVID-19 to gather information about your illness, about your clinical status, about when you started feeling ill.
Elena Diskin leads the contact tracing unit at VDH. She says case investigators are trying to help you and the community.
So it's really important to understand what's happening, where people are getting sick, when people are getting sick, and who's getting sick, and where COVID is spreading.
Case investigators will also ask about vaccination status, and they'll verify it through the state vaccination database called the Virginia Immunization Information System.
It's important for our public health professionals to ask that question, again, to kind of be able to help predict how well the individual is going to do, to better understand their vulnerability to progression of illness.
Dr. Param Jabari, who's the acting health director in Norfolk, says it's also important to verify vaccination status because it could impact a potential quarantine.
Knowing whether you're vaccinated or not helps determine the length or even the need for quarantine.
Case investigators try to reach every positive case, but Dr. Jabari says sometimes names fall through the cracks. He urges people to answer when they are called.
The questions, the conversation, hopefully will guide the individual in terms of what some of the next steps may be, what to look out for, but it also helps public health really accomplish its mission in protecting the community. So it's vitally important that individuals do respond to those calls.
Dr. Jabari says all of the information that they collect is kept confidential. It is only used by public health investigators, but if you do get a call and you're skeptical, you can always call your local health department to verify. I'm Marielena, Balouris, 10 on your side.